Everybody, Madison here with Health by Ratio, and in this video we are going to cover some of my favorite exercises to train the core, how to support the lower back in some functional ways, and especially around how we bend over to pick things up, because those of us that have dealt with back injuries or pains or spasms kind of thing, most of us have experienced that dreaded moment where we go to bend over and pick up the laundry or the groceries, and all of a sudden back seizes and we're now crawling around on the ground for the next several days and doing emergency calls to our massage therapist or acupuncturist or getting in some physical therapy as quick as humanly possible, since we can barely move with our back seizing up on us. So that's what I want to cover in today's video. For those of you who don't know who I am and what my team and I do, I'm the founder of Health by Ratio, and my team of licensed physical therapists, orthopedic movement specialists, and functional health coaches work as a team with our clients virtually to take holistic approaches to help our clients achieve their health and fitness goals. Meaning, we help our clients recondition how their body moves, how their body is holding themselves posturally, so that we can help them truly rehabilitate from recurring and chronic injuries and pains that they might be dealing with. And then beyond just the rehabilitation side, we want to translate that to whatever active lifestyle they want or whatever their fitness goals are, so that they can live the abundant lives that they desire. So that's what my team and I do, and that's why this video is so applicable, because so many of us deal with chronic lower back pain. And like I said, it comes from often dysfunctions in how we bend over to pick something up, or the core isn't really supporting us well. We all know that we're not supposed to really round the back to pick something up heavy, especially something heavy, but even something relatively light. And we've often been taught to like pick up from the knees. That's not always necessary, but that's an often a cue that we hear. But what is also really common that isn't kind of pointed out enough, in my opinion, is that we also have these dysfunctions where we'll often roll the shoulders forward as we're picking something up. And when we roll the shoulders forward, that disengages the big mid-back muscles that connect directly to how the core stabilizes. So when those guys aren't firing well, in terms of the upper back, it puts way more strain on the lower back as we are picking something up. And then often, to compensate with that poor shoulder position, is we'll often crane the neck, we'll turn the chin up, and we'll kink this neck to basically create some compensations in engaging some of the neck extending muscles, that because of what's missing in this big important upper back complex. So we often will end up sacrificing shoulder position and the neck health, and in the meantime we compromise the lower back as we're picking something up, and so it's a recipe for disaster for multiple things. So I want to talk about some of my favorite exercises to retrain us how to hip hinge correctly, bend at the waist to pick something up. And I want to start from the ground up, because this is often a safer way to kind of rebuild, and it's very functional on the ground too, if we're gardening or we're cleaning the house, or for a lot of our clients that are contractors that are doing manual work, they're obviously needing to get on the ground very frequently and pick things up, getting stuff out of their tool bags, and they're on their hands and knees as they're working around. So this is very functional for us. And then I'll talk about how this translates to positions on our feet. You can do all this stuff body weight, but I'm going to use a resistance band to kind of aid in some good contractions of my glutes even more so, which it helps my core establish better stability around this whole lower back health. Now, before I jump into these couple of techniques, I would encourage you, first and foremost, if you are not a subscriber to our YouTube channel, or if you don't follow us on Facebook, both of those platforms are at Health by Ratio. Make sure to subscribe to us. Make sure to follow us. We're posting weekly content all the time on holistic health and fitness, so you'll be able to see the future videos and content that we post. But also, something that I constantly am talking about in our videos is, even though these are some great exercises, I want you to know they're not necessarily the end-all be-all. We recommend these for a lot of our clients, and we coach them through how to do them correctly, but it's not necessarily going to get them completely where they need to go, because it really depends on how each person moves and why they're doing what they're doing. And all of us have different movement and postural portfolios. We all move a little differently. We've all had our own traumas, our own movement patterns and habits and activities that we've done. And that equates to different imbalances and different kind of quote unquote dysfunctions that impact the body. And often I get asked, like, what's the best exercises to support the back, or the best exercise to restore knee range of motion after an ACL or meniscus surgery, or what's the best exercise to restore good posture around our neck? Like, it really depends on each person. And I think we've been conditioned by, unfortunately, a lot of our kind of current medical practices around injury rehab, where they kind of take a cookie cutter approach. Often, like, we get kind of the same 6 to 8 exercises that everybody gets in this printout, and we're told to do 3 sets of 10 and call it a day. And that's often, to me, why, again, we're chasing symptoms. We're helping a specific area maybe heal in the short term, but we're not addressing the unique movement portfolio of what that person is doing that's really causing these injuries. So these are great. I encourage you to try them out, but they might not be the end all be all. I'd be happy to help you with that. My team and I do this for free in our free video assessments that we offer everyone, where we analyze your movement and create game plans with you on what specific stretches and exercises to do on a holistic way to get your whole body moving from head to toe correctly. But I wanted to preface that before jumping into these. So without further ado, let's jump into the hip hinging exercises. So like I said, I want to start off kneeling, and this, again, can be done just body weight. I do encourage you, no matter what, though, to have something nice and padded, whether this is a really rolled up towel, whether it's a pillow. I have my foam pad here that I'm going to use, but we're going to start on on both knees, and we're going to have a band right now connected, just pulling me straight back. So for me to be upright, I automatically have to engage my glutes. This is a proprioceptive response, meaning for me to just come up here, my glutes have to tighten for me to stay vertical at my entire torso and upper thighs here. Otherwise, if they didn't engage, I'm going to be in this kind of a position. I'm going to be overarched. My butt's going to be back a little bit. I'm not going to be totally upright. So I'm using this band to kind of wake up my glutes and teach them to engage immediately. Now, I'm going to place my hands at my chest, and I'm going to get my chin neutral by just doing what's called a chin tuck, meaning I'm going to push my chin straight back. I'm not going to look up here. And I want to keep my shoulders back and neutral. I'm not like big chest position like crazy, but I am going to pinch my shoulders back enough to engage kind of my lats and mid traps and rhomboids, those big mid back important muscles. And then from here, I have my toes active. I'm up on my back toes here, and I'm about shoulder width apart. I'm going to stick my butt back on my heels. So that's what I'm thinking, kind of like booty bumping. I'm trying to stick my butt back on my heels. And then as I come up, I'm going to think clench my butt cheeks as I stand up, or I should say kneel up, and tighten my core. Then stick that butt back and squeeze the glutes and core as I come up. Notice that my neck and shoulders, they're not changing at all. As my torso angles forward, so does my neck. I'm not going to stick my butt back and look up as I do so. Let your chin stay neutral. Let the eye line, let your gaze go back down towards the ground as you come in and out of this. But I'm training my glutes and my core to support my back. And if you notice, my lower back has its normal kind of curvature there. I'm not overly arched at my lower back, but I have my normal curvature. And when I get into this position, it's still in that same normal curvature as I come in and out of it. I'm not overarching it, and I'm also not flattening out by rounding the lower back there. So I want to stay neutral at this torso and just drive it through my glutes. Now, the next progression to it is in half kneeling position. So now I'm just going to have one foot active, one knee down. I'm going to be squeezing my down knees glute. So in this case, it's my right glute. And I'm going to do the exact same thing, sticking my butt back towards my heels. I'm going to feel maybe a little bit of a stretch in my hamstrings there. And then I'm going to drive that glute, clench that glute to drive my hips forward again, fighting this resistance band. Same principle, with my shoulders and neck. And then obviously I can do this to the other side, get my activation towards that other hip and coming in and out, keeping the shoulders pinned back and the neck neutral as I'm squeezing that down knees glute. So it's very functional to me having to bend forward and grab something or pull some weeds or whatever. Now, these are kind of the foundational ground positions that we can do. And because we're kneeling and we are in this kind of safe environment, it's something that we can slowly build our body back into in terms of how to hip hinge correctly. But now I want to translate this to standing because obviously I also want to be on my feet and be able to bend over and grab something. So same idea, but I'm going to have this band now at more hip height pulling me backwards. And I'm going to now just get into first what we call active standing in the Health by Ratio program, meaning I'm going to stand shoulder width apart. I want to make sure that my toes are pointed straight ahead. I want to get my glutes active. I'm going to squeeze my glutes. I'm going to kind of screw my hips into the ground a little bit. I'm trying to pop the arches up into my feet so they're kind of raising into the ground by, again, screwing the hips in is kind of thinking about screwing your hips laterally into the hip sockets there. Then I got my core engaged, I got my shoulders back, my neck's neutral. Now I'm going to do the exact same thing I did on my knees. I'm going to stick my butt back on my heels and notate here, I have soft knees. My knees aren't bending down like I squatted, but they aren't totally locked out. And then I'm going to squeeze those glutes and screw my hips into the ground as I stand up, fighting that band from pulling me backwards, in and out. The next variation to it is kind of similar to the half kneeling version. I'm going to have one foot planted, then I'll have my other leg just kind of kickstanded behind me. All of my weight is on the plant leg right now, though. And now, same idea, I'm activating my glutes, I'm tightening my core, I got my shoulders and neck neutral, and I'm going to stick my butt back on my plant foot. The other leg's just kind of dead weight. And then I engage that glute as I come standing all the way upright. To the other side, I'm all planted. I got my glute active. My back leg is just dead weight. And I'm hinging down and squeezing that glute, training my neck and shoulders to stay neutral as I come in and out of this position. So I am keeping that back nice and supported. And with me using this resistance band, I'm naturally waking up my glutes properly so that my core is active, so that when I go to pick something up, I'm actually using my big, important glute and core muscles to support my spine as I'm moving in and out of this position. So, guys, if you have any questions on this, if you want some tips or tricks on your own injury that you're looking to recover from or the fitness goals that you want to achieve, feel free to message us or right below the comments in this video. And like I said before, if you aren't subscribing to us on YouTube yet, then subscribe to our channel. If you're not checking us out by following us on Facebook yet, follow us there. Both of those are at Health by Ratio, and you won't miss any of the future content we are putting out on a weekly basis, all around this holistic health and getting you guys to be in control of your own health and fitness. Talk soon.